Welcome to the podcast, where the path you make is the path you take. Today, I'm here with a special guest. Please introduce yourself.
Assalamu alaikum, Mariam. My name is Wahida. I'm a sonographer.
Okay, let's begin this interview with some general pathway questions. First, what steps exactly did you take to become a sonographer?
What I did nuclear medicine first because in the past, ultrasound was a post-diploma program. So you needed to do something in healthcare before you get into ultrasound. For example, nursing, paramedic, x-ray, or nuclear medicine. I decided to do nuclear medicine because it sounded really interesting. At this time, I hear that they can even take people out of high school because there's a huge shortage of ultrasound technologists. They found that whoever went into nursing stayed in nursing or stayed in x-ray, and they didn't, decide to go into ultrasound after they had jobs. So they had to make it into its own program at this time. But there are quite a few requirements, and it requires very good grades in order to get into ultrasound, as it's a very competitive program.
Right. Were there any courses in specific that you needed?
Most of them are the sciences, the biology, the physics, not so much chemistry, but for sure math. Physics for ultrasound is very specific to ultrasound. So you learn a lot about the sound energy because we use high frequency sound energy to make our images. These sound energies are completely safe, but it's beyond our hearing. That's why we also use it in, examining a fetus, because we know, as far as we know, it's very safe.
Yes. What skills were most important for you during training?
Patient care is very important. You need to, understand why your patient is there. The patient usually, has some kind of pain or discomfort. They go to their doctor. Their doctor recommend an ultrasound. They always start with an ultrasound because it's the safest for the patient. So, for example, let's say that the patient has an abdominal pain, sharp pain. Sometimes it's in the back. Usually after eating, so their doctor would recommend doing an abdominal ultrasound. There are many different kinds of ultrasound, but the abdominal ultrasound would be the right scan for this patient. When the patient arrives, they have to be fasting, and we apply some gel to their skin just because sound energy gets diffracted as it goes through different mediums. So we want body is mostly made of water, and then so we apply the gel. So the sound energy from the probe goes through the gel to the skin, and then it comes back to the transducer, and that's how we make the images. When they arrive, we look at all different organs, not just usually the doctor would want to know if they have a gallstone or something, but we look at the pancreas, liver, kidneys, aorta, and their gallbladder, and then we examine to see if we can answer why this patient is having abdominal pain. If we don't diagnose, the doctor can't, prescribe medication. The surgeon can't operate on this patient. So we are the most important step in the diagnosis of this patient. Without us, they're not able to help the patient unless they do like an MRI or a CT, which CT has a lot of radiation and it's not recommended. An MRI is very rare, so it takes months to get into, get an MRI. So ultrasound is fast, it's easy, it's a lot more cost effective, and then we can help the patient faster.
Thank you. Okay, so since this job is so important, I'm assuming it's pretty competitive. What was your experience trying to find a career?
They do give preference to the people who've been in the healthcare industry. So because I was going from nuclear medicine to ultrasound, it was actually fairly easy for me to get in.
Right.
But in my graduating class, we only had 14 people. 4 of the people were not able to graduate, so only 10. We have a lot of foreign doctors in the ultrasound program. They're usually very good academically, but when it comes to like speaking language, then it's much harder for them because they're not able to communicate with their patients. Yeah, it's quite competitive, but it's worth it. It is a difficult program, but when you graduate, you're high in demand. You can find a job anywhere you want. If you decide to go somewhere outside the city, they provide very good, compensation for the move, for the flight, for the, hours that you work. So you're always in demand once you finish the program.
That sounds like a great deal.
Yeah,
Did you find that this job has good career protection?
definitely. I've been in ultrasound for many years. I don't remember someone applying to the clinic and us not hiring it. So if you apply and we know you can do a good job taking care of our patients, we definitely hire you.
Sounds good. For anyone interested in this path, what would a starting salary look like?
We typically start at $49 to $50 for the clinic, and we provide good, benefits. Like a lot of clinics have RRSP matching for pension planning and things like that, and some kind of profit sharing. Yeah, it's a very good career and it's very rewarding.
Yeah, that sounds really reasonable considering the amount of hard work you guys do. I was wondering, what does a typical workday look like for you?
So, in ultrasound, for the abdominal scans, ultrasound can't see through gas, so we don't want our patients to eat or drink for the abdominal scans. So when they arrive for an abdominal scan, we typically, schedule them in the mornings. They arrive fasting, and we do their scans in the morning. Later in the afternoon, we do a lot of renal scans, and we do a lot of small parts like thyroids, bumps, and lumps, looking at vascular exams, because they don't really require any kind of prepping. So all our fasting patients are at the beginning of our day, and later, because there can be complications in their exams and might take longer, then we finish with the smaller cases. And then in the afternoon, we usually have a lot of our obstetric patients. So those are our pregnant patients. They come in and we do the fetal assessment and growth and fluid. And then usually we finish with pelvics and other small parts in the afternoon. Usually it's a very busy day. You pretty much have a patient every 30 minutes.
Wow.
And then you do get like 2 breaks in the morning and in the afternoon, and a lunch, a half an hour lunch as well.
That's good. Okay. Out of all these different types of scans, what tasks fill most of your day?
What fills most of my day? Depends on the day, because we do a lot of subspecialties as well, like MSK shoulders, breast imaging, liver elastography, or NT exams. I'm most specialized in babies. So my day is usually filled with a lot of baby scans. And maybe, earlier in the morning, I do a lot of abdominal scans as well.
That's really exciting. How do you balance the technical parts of scanning with making your patients feel comfortable?
It's very important because you need to have your patient consent, and you need to be very attentive to your patient's needs before you're able to do that exam. So you have to make them comfortable, explain everything for them, answer their questions, and listen to them. And then we always ask our patients why they're there, were they hurt, why did their doctor sent them for this test, just so we can really tailor our exam to that patient and then to answer the clinical question. So it's very important to make a good report with your patient so you're able to do their exam. Some exams can take longer. Abdominal scans are about half an hour, and then the assessment of the baby is usually could take anywhere between 45 minutes to an hour. So you have a lot of time to chat with your patients.
That's really nice. It seems like you have a very busy day, but very rewarding. Can we go into some comparison now?
Of course, sure.
Okay, so since ultrasound doesn't use radiation, how does that change your work compared to other imaging careers?
I feel good doing the ultrasounds because, I know my patients are safe. I'm only using sound energy, and sound energy is everywhere around us. Um, I Sorry, what was the question?
How does your work change compared to other imaging careers?
Imaging. And then because you're in an ultrasound room like the whole time with your patient, you have a long time to talk to your patients, to also make them comfortable, to be able to do their exam, and then to also assess them very well. You're the closest to being a doctor, trying to do your assessments, and make the images. At the end of your scanning, you do report to a radiologist, but the radiologist is not in the room. So they just, diagnose based on the work you have done and based on the images you've taken. So it's important to take very good diagnostic images as well to do a very thorough assessment of all their organs.
That's a really good point. On that note, how much interpretation do you do compared to the radiologist?
We interpret every single image and we give our feedback to the radiologist. Of course, they're the ones that make the final decision, but definitely they rely on us heavily, because unless we find the issue, diagnose it, take the right images, they're not able to report to their doctor. So I really take pride in my job, and I know I need to do a good job, because then I'm able to help, preserve the patient's health and to also improve their health.
That's a great answer. Thank you. How much independence do you have while working?
We're very independent. You have to be independent as an ultrasound technologist. You keep track of your schedule. You always plan to take your next patient on time. And from the beginning of the exam to the end of the exam, you're in charge of making the best decisions and, helping those patients. So you're quite independent. Usually nobody is watching you. And unless you need help, you can go to the radiologist or a colleague, but you're doing all your work in your room with your patients.
Oh, speaking of that, would you say that your job is more focused on the technology aspect or your patient interactions?
Both, definitely both. You have to interact with patients, let them know what is happening, what the next steps are. But you always have to work with the technology, know it inside out, and then know all, the capability of your ultrasound machine. If you have an obese patient compared to a slim patient, all the parameters are different. You really focus to penetrate deeper on an obese patient, whereas if you have a slim patient, you focus on taking the most detail out of your images, for sure.
That's an interesting point. What type of person do you think would enjoy your field more than other imaging careers?
I think someone who wants to be a doctor but doesn't have the time to, go through all the years of education. And like I said, it's the closest you can get to being a doctor. And you can definitely make a difference in your patients' lives by finding the issues, and then diagnosing it in a timely manner so that the patient can get help.
Is there certain skills that you find make people very successful in this career?
You have to be a people person, so you have to be able to communicate well with your patients. You have to be able to communicate with your team, your coworkers, the radiologist, even the patient's family members, because as you know, we do a lot of obstetric imaging, and a lot of times the patient's partner is there and they're super excited, and of course they want to see their baby and find out the gender, but that is not the point of ultrasound. We're there to make sure that the baby has a brain, has a heart, has kidneys, that has all its limbs, that all its organs are working and functioning properly. So we have a very important job to do before we can, focus on the fun aspect of showing the baby and the baby's movement and the baby's gender. So definitely anatomy comes first. You have to make sure the baby and the mom is happy and healthy before we can show the baby for entertainment.
That's very sweet. Is there a type of scanning that you enjoy the most?
There's a special ultrasound that we do, and it is around 12 weeks. It's called the nuchal translucency. It's to do a very early check on the baby and make sure that the baby is developing healthily, and this is a very specialized ultrasound. You also make a special measurement that gets incorporated with the patient's blood work to make sure the baby is healthy. That measurement is super important in ultrasound. So I like making those, precise measurements, and then make sure that the baby is happy and healthy inside the mom. So nuchal translucency is my favorite. We also started doing screening breast ultrasounds. It's called ABIS. This machine is new to BC, and I have just been trained on it. So now we're going to be starting doing the screening breast ultrasound, which is not currently covered by MSP, but hopefully one day it will be. At this time, it's just for the private patients.
Thank you. And thank you for your answers on the second section. Now on our final part, the reflection. What's the hardest part of being a sonographer?
I think it's a very physically demanding job. You have to sit still for quite a long time, and you use a lot of your shoulder, arm, and wrist to do the scanning, and that can be difficult physically. A lot of times you have to lean over the patient to do their left side, or the baby is mostly on mom's left, so you're doing a lot of your baby's heart imaging on the left side. So it can be physically demanding. Also, depending on your patient size, you have to apply a lot of pressure to make good images on the patient for the diagnosis. I think, but if you do the right exercises, and then you do strength training, and then know when to take those micro breaks, then you're able to protect your body and your health for sure. So that's probably the most challenging. Also, we normally have a lot of good news for parents or for our patients, that maybe things are okay, and maybe it's just this minor thing that they can get help for and get better. But when you find something very sad on a patient, or you find something like cancer, then it's heartbreaking, and it's hard, especially when you've gotten to know your patients. The good thing is that that they can get help, and hopefully it's an early diagnosis and they can get treatment and get better. Sometimes you find fetal demises unexpectedly, so it's hard for the mom, expected mom, and the family. So those are the more challenging part of my job. But in all those cases, I'm still helping my patients, either preserving the mom's health or the baby's or the person's.
Is there something that keeps you motivated on those more difficult days?
Knowing that I'm making a difference in their lives. For example, the hardest part is to find the fetal demise. I know that cannot stay inside the mom anymore, that it's something that, the mom needs to, take treatments for, and then get better, and then hopefully start trying again to make another baby. But knowing that I'm making a difference and trying to get them better motivates me to keep going.
That's a beautiful answer. Thank you. What's something that you've learned from this career that you didn't expect?
Many things. I think in ultrasound, you never stop learning. Every patient is different. You've always find something that you've never seen before, and sometimes we, have to like Google it and then be like, does this exist? What does it mean? There is always room for more learning. You just find it, and then you're like, I've never seen this before. I haven't seen this on this kind of patients. Like, my patient is like too young or too old. It's just you never stop learning. You just keep going. And every time I attend conferences or workshops, I find new things and I learn new things. It's always interesting. It always keeps you on your toes. Yeah. And yeah, that is very interesting for me.
I like that. Do you see this career ever changing in the future, though?
It definitely has changed a lot since I've started doing ultrasound. Our machines are getting smaller. They're getting, more ergonomically friendly. Um, there are portable ultrasound machines. They even have robots doing the, but I'm sure they can't replace the human power for sure, because you wouldn't know what to do. But yeah, it's changing all the time. The technology is getting always better. And then we find like new diseases, new things to look at, and they always come up with new things. Like the perfusion studies are very interesting. More detailed assessments of the heart or baby, or abdominal organs, blood flow to the organs. Even in ultrasound, they've started like injecting the patient with certain things and being able to, see certain organs better with contrast.
Oh.
I don't see it stopping. It'll only like get better in future.
Yeah. So with all of this in mind, if you could go back, would you see yourself repeating this career?
Ultrasound, definitely. I love doing ultrasound. I always wanted to be a doctor, but because of different priorities in life and cultural expectations, I'd be like, you need to get married, you need to have a home, you need to have a child. I knew the doctor's life is not easy. Working my job right now is like a 8 to 4 o'clock job. I don't have to do because I work at a clinic. I don't have to do nights. I don't have to do evenings or weekends, so I can be there for my family, and I can meet people's expectations of being a wife and a mom and everything. But I can also do what I love to do, which is contribute to my society and then make things better, educate people, and train the future sonographers. Making a difference in people's lives make me really happy. And I think my children look up to me and they want to do something that's fun and rewarding as my job, and I'm happy that I'm able to do this job.
I'm sure they do. That's a very insightful take. And I was wondering, if you could reflect on your career, would you recommend this to anyone curious?
For sure. I think in ultrasound, it doesn't matter. Males or females can do this job. Definitely, there are certain areas that males can take over, and it makes it easier for the females. And then for us, we definitely, our female patients are way more comfortable with us scanning them. Some more sensitive organs like breast and all this, they prefer a female sonographer do the examination. And I'm happy to be there for my patients to provide that comfort for my patients. But then there are exams like, testicular exams and things like that, that probably my male patients prefer a male sonographer do it. So I would recommend it to, everyone, male or female. It's a good career. It's a good job. And that they'll always be in demand. No matter where they go, they'll find a job. A lot of my colleagues, travel to Europe, to New Zealand, to Australia, to, have a year of fun and also work in a different country. So the options are there. You can, always go up north in BC and do like a locum there. It's quite interesting because you get to see, somewhere different, and also help people who don't have, all the things that we have in the city. I definitely recommend it to everyone or whoever is interested.
Thank you so much for all of your helpful answers tonight and for everyone else for tuning in. Thank you.
Yeah, thank you. Thanks for having me here, Maria.